Hi, my name is Komalpreet. I am a student of Hospital Unit Clerk in the Bhopali Hospital. Today I am going to represent the video presentation that's on diagnostic test images. My topic is the Positron emission tomography and he's my client. His name is Deep. Hi, how are you today?
Good, thank you. I just want to know more about this positive emission tomography. One of my relative, he has this problem.
Okay, you want to know what positron emission
Yes, what is
tomography?
that?
Yeah, positron emission tomography is a nuclear medication technique. We are taking the 3D image, the functional part of your body, and we are using the tracer in that to see the organs and tissues in your body. The doctor ordered this test to see the disease, what's going on your body, what's the disease going on your body.
What is the purpose of this?
The purpose of this test, they want to see the blood flow, oxygen intake, glucose metabolism in your body. The doctor ordered this test to how's your blood flowing, how's glucose level, how's oxygen intake. The main purpose of this test, they want to see the cancer, heart problems, tumor, like that kind of things they want to know.
How is this test done?
The test is done. If you are wearing any jewelry, you have to remove that jewelry because they are disturbing your scan, right? You have to remove that and you have to wear the gown. After that, they insert the tracers in your vein. Then you have to wait for an hour because the tracer need to absorb your body, right? Your body, you need to absorb that tracer. And when the body absorbs that tracer, then you have to lay down on the bed that attach to the machine, and they are slowly glide the table into the scanner, and they are start taking the picture they need to take, right? And you can listen, there is a clicking or buzzing noise is coming. When they are done, they will let you know, and you can get out from the bed, and you have to wait for outside for the few seconds, because they want to make sure they are good, their pictures are clear.
Okay.
Yeah.
So how long the test takes?
Yeah, it usually takes 20 minutes, but they need a time for preparations. You need a time for 2 to 3 hours in the faculty.
Is there any medication used?
Usually there is no medication. Sometimes you are not feeling well. The client is not feeling well. They need to relax the client, and they are giving the medications to the client. If you are taking that medication, we are not recommend you to drive, and we need a support person for that person.
Is there any preparations you need for that?
Yeah, there is a preparation for the diet for this test. The main you have to manage your diet 12 hours prior, because when you are going for the scan, then you have to manage your diet. I just recommend you the low carbohydrate diet that includes some meat, vegetable with low starch, tofu, like that kind of things. If you are going for a test in the afternoon, then you have to then they recommend to a low carbohydrate diet. If you are diabetic, then you have to let you know your doctor you are diabetic and you are taking that medication, and you have to check your sugar level 48 hours prior to the test, because you have to manage that.
Okay, is there any risks involved?
Usually there is no risk involved, because the radiation that used in the test, they are very few, is equals to the several year of environment radiations. But if you have a problem with claustrophobia in the scanner, then you have to let you know your doctor, because that disturbing your test, right? If you have a problem, then you can let them know, and they can take the step to minimize your that feelings. And if you are pregnant, then you have to let you know, because that's not good for your health. You have to let them know. Sometimes there is more tracer used, that helps, that's affect your kidney diseases.
Is there any after hour care that you need?
There is aftercare instructions. There is no aftercare instruction because their radiation level is very low. That's why we are not recommend any kind of the care after that. If your doctor give you any slip they want to the special steps to follow, then you have to follow that. Otherwise you can do whatever you want to in the normal life. If you have, but there is a important thing, you have to drink a plenty of water, because you want to flush out that tracer out of the body, because it's just staying in your body is 2 to 3 hours, not more than that.
Okay, thank you.
Oh, welcome. As a HUC, we need to contact with the department, diagnostic department, and there is a special department for it, that's called CT department, computers technography departments. We need to contact with that department. If they sometime first step HUC need to be followed, they have to complete the communication process with the customer. After communication process, they need to fill the recognition form, and they need because the patient is going to that department, they need a transportation for that department. They need to book the transportation, and they need to book the porter for that persons. And sometimes they need a translator, because some patient, they are not fluent in English, then they need the translator. Yeah, that's all. Thank you.